everyone. We are almost coming to the end of our session. I'm so excited for this session. We have with me Isabella, who's going to co-host. It's been a very long day.
It has.
We couldn't wait for this session. It's a very special session for us. We have Dr. Lakiea Bailey joining us all the way from the US, and it's very early for her. We had to wake her up early. I'm sure she's as sleepy as we are. We are almost winding up. So Lakiea, welcome to our session, and we are so excited to have you. Isabella, you can come in as well. And for those people that are watching us for the first time, my name is Agnes. It's been a long day. I woke up at 2 this morning. Part of Team ASCA in Victoria, and Isabella is in Queensland. And okay, so
we're just waiting for Lakiea to unmute.
I promoted a different Lakiea, or was somebody joined in as Lakiea?
There you go.
Okay, so I think we've got the right one. Who's I think somebody used her name to join in.
Oh.
So yes, as I was saying, my name is Agnes. I'm joining you from Melbourne, Victoria. It's been a long day for us, but we couldn't wait for this session. We have one more to go before we end and come back in the next, I think, 6 or 7 hours. With me, I have Isabella, who's joining me from Queensland. She's the president for Australian Sickle Cell Advocacy in Queensland. So welcome, Isabella.
Thank you, Agnes, for having me. And I don't know why I'm getting feedback, so there you go. Welcome, Dr. Lakiea. Thanks for joining us. We're very much looking forward to your presentation on the state of sickle cell in the USA. Since this September is Sickle Cell Month for you guys out there, and you'd actually be advocating quite a lot so far, since we're sort of mid-September now. So I'm looking forward to hearing your presentation today. So welcome to our first Australian Sickle Cell Conference.
Thank you so much. How's my audio?
Sensational.
Perfect.
Yeah.
Wonderful. Thank you so very much for having me here and inviting me. It is my honor, a distinct pleasure to be able to connect with you all in Australia. I am looking forward to many, many more opportunities to come as we work together to start to close the gaps between our various countries and bringing us all together on this global space. I am Dr. Lakiea Bailey. I am a sickle cell disease researcher and advocate. I'm also a patient. I do live with sickle cell disease. I'm a sickle cell warrior. And I am the founder and the current executive director of the Sickle Cell Community Consortium. And we are a network of sickle cell disease community-based organizations from throughout the United States and outside of the US, as well as sickle cell patient and caregiver leaders in advocacy, those who are actively working as advocates in their space, either locally or nationally or globally. We're thrilled to be able to partner with groups like Australia. I'm so excited to have met each and every one of you. We recently completed our convention at the end of last month, and we approach advocacy in a few different ways. And the state of advocacy in America, it depends on which direction you're looking. And so we have recognized that when we are talking about advocacy, we are either referring to legislative advocacy, policy work, we are referring to health advocacy and patient advocacy. And here in the US, what we've done specifically at the consortium is begun to create training programs to assist with individuals who wish to become powerful advocates in either of those directions. The legislative advocacy portion is one of the most powerful ways to begin to create change. And so here in the US, of course, that is a very, very slow and delicate process. And there are specific groups that are focused and they have their attention entirely geared on the legislative area, making changes on Capitol Hill where the laws are defined, made, and executed. And then there are the policies. It's these policies that define the treatment in hospitals. It's these policies that define a lot of what's happening here. So the state of advocacy in the US, it's being, I would almost say, snagged at the moment by the current opioid epidemic. And what they are referring to in the US when they say the opioid epidemic is there was a spate, a large gathering group of individuals who were becoming heavily addicted to painkillers. And I have expressed on the Hill, and I've expressed to others, that the chronic pain patient, individuals like us living with sickle cell disease, we are not the authors of that opioid epidemic, but we have certainly become its victim. And we are now being affected by the laws that are being made and access to painkillers when we're in the hospital and outside of it, the ability to fill prescription. All of that has been made incredibly difficult. And so that piece of things has become a big, I'd call it a thorn in our side when it comes to progress and when it comes to continuing to grow and to develop our legislative advocacy arm in the US. There is, of course, the results of that, and it is not new. I tell people COVID-19, it caused many other rare disease groups to suddenly experience what we in sickle cell have always experienced: a lack of access to standardized care, not being able to go into the hospital and being treated fairly or as though we were not there for drugs and drug seeking. It caused others to see things in that light, but it had always been that way for those living with sickle cell disease here in this country. And so, and abroad, I'm made to understand. And so the patient advocacy is a big piece of the advocacy work here in the US. I see questions coming in about legislative. Agnes, did you want me to finish and then answer questions, or how did you want to?
Yes, I think that's right. Just finish and then you can answer the questions as after you finish. Thank you so much.
Absolutely. And so legislative advocacy and the policy, I'll come to that and answer your questions. And then we have patient advocacy. And that is a big part that people can take on an individual level, learning to advocate for ourselves, learning to advocate in our communities and in our hospitals and with our doctors, and advocating in our for each other. That is a mantle that we have had to pick up, and the community-based organizations have had to pick up for ourselves and for our fellow sickle cell siblings. When we are referring to health advocacy, that also is a very big piece of what we're doing. Advocating for the patient. You are only a patient when you are inpatient at the hospital. The rest of the time, I am not a patient. I am Lakiea Bailey, sitting here doing work, working with my community, engaging with my family, but still must advocate for my health, my day-to-day individual health. And so we, specifically at the consortium, but in the US, I believe that the state of advocacy has been broken into those three pieces: legislative, patient advocacy, and health advocacy. And then we are working collectively to approach that in a way in which we are able to gather our forces, because we are stronger, as was the theme of our convention, together. We are stronger when we are united as a collective and powerful force. Most recently, there have been a few situations in which we have had individuals to reach out to me, in three different hospitals in 3 different parts of the US, each needing a very important life-saving surgery and each unable to access it. And so we have had, we're very, very privileged that I know so many wonderful people that we began writing letters and emails. We wrote the president of a hospital. We wrote the chief of medicine. We sent letters to legislators because this individual needed to have this incredibly important surgery, at least needed to be put on the list to be able to have that surgery. And by working together and combining our voices, we were able to make that happen. And so it is the process that we have found the most strength in is instead of attempting to go after these things individually, we come together in order to work as a powerful, united voice. A lot of the advocacy in the US is focused in these areas. Currently, there have been, we were able to get certain laws passed. We were able to get certain bills passed, not laws, bills passed. But here, the way, once a thing is passed, it doesn't actually matter yet until it hits appropriations and until the checks get signed and the money is distributed. That's where things hung up in 2020, where we were able to get bills passed, but the money behind those bills. And so legislatively, we had the honor of hearing from Admiral Gerard. Dr. Gerard was formerly the OASH, he was the Assistant Secretary of Health in the US. And he has outlined a fantastic legislative advocacy plan. There's an organization here that has put a great deal of strength in their efforts behind legislative advocacy called Sickle Cells. Sickle Cells is working with the SCDAA. We've partnered with the Sickle Cell Disease Association of America to create a unified legislative advocacy so that we are all moving forward with one voice in order to present, here are the things that we need to see. And then we have to go after appropriations. We have to make sure the funding is put behind it. In the area of health advocacy, we have some wonderful individuals, including a person that we've worked with who has recently started her organization to train us in health advocacy. And we're excited to work with Dr. Simone Uwen, who is also a sickle cell warrior, and there are many, many others, including programs at the Sickle Cell Consortium, where we are helping to provide what we call the expert patient, so that we are experts in this space. This is what an acute chest syndrome X-ray looks like. This is what is done for it. Here's the treatment for avascular necrosis, which many of us suffer with, including myself. And then patient advocacy. In this area where we're working is in making sure that we all understand how to advocate for yourself in the hospital and others. What is the chain of command in order to escalate an issue that's happening? What are your rights and your responsibilities as a patient? And how can we collectively create change in the realm of advocacy in the US? I believe that one of the most powerful things that we're going to be able to do moving forward is to continue to unify our voices here in the US, and then to collectively unite with those of you in Australia and everywhere else in the world as we create a unified global voice for our global human rights as sickle cell disease warriors, as patients in our various countries. Basic human rights. Here is, I saw that you all have actually or will be hearing from the World Health Organization and the things that are in place there. And I'm very excited to see that, because I think that as we unite globally, there is where our true strength and power lies.
Thank you so much for that elaborative statement, Lakiea. It's good to know what's happening in other parts of the world, especially for us, because we're a very, very young organization, and we learn from organizations like yours and other organizations also across the world. I've just got maybe you can answer the questions and in the chat box, then I have a question as well, and maybe Isabella has questions. So before you answer the questions in the chat box, Isabella, do you have anything to add?
I guess I do, just from listening to you, Lakiea. It's really about re-educating our governments, isn't it, really, to stand up and listen and provide the healthcare that we deserve, that we pay our taxes for. So I guess in doing that, the best way to do it is by having lots of voices speak up about the same thing, so that change can be made. I guess I've been with this fight, I guess, for about 30 years. I have children that have sickle cell thalassemia here in Australia. It's been hard to educate just doctors, let alone governments. But I think we're getting somewhere. The more of us that are around and the more of us that are speaking up, just from this own conference right here, I've seen changes. I've seen changes from everyone. There's no, I don't know what it is, you know, sickle cell warriors are addicted or any of those kind of things. We're making progress, and that's important, and I'm glad to see it. So thank you, Lakiea.
Absolutely.
Yes,
Thank
we
you.
are making progress, but actually, no, before that, please answer the questions in the chat box, because I've got a very sensitive question to ask you, Lakiea. So please go ahead and answer the questions by KW Young in the chat box, please. Thank you.
Okay, I'm pulling that up now. How post-legislation policy, how can we do sustained implemented advocacy? Okay, it's good to see you, KW. So hold on, I have an echo, I apologize. Let me figure out why. I think that there are multiple steps in implementing and sustaining advocacy. And the first, I truly believe, is recognizing what level of advocacy you wish to implement. Are you going to take on legislative? Are you going to take on, and as Isabella said, are we going to start working with our government and going towards, these are the things that we need to change? Because in the US specifically, the best ways in which I have found to do that are to work with champions, to work with individuals who are actively trying to do the same thing and have a similar vision, and to begin to create the policies, to begin to visualize and to work on what it is you wish to see change, to identify specifically, here are the areas that we wish to see change, and here are the ways in which we'd like to do this. I believe it is Tuesday and that I will participate in a congressional briefing, and we have found champions such as Danny Davis, who is a representative who has taken on sickle cell. And working with those champions in a legislative way is the best way that I have found. And then being consistent, having your specific ask and your contact, and this is what we would like to do, and being willing to work with and talk to anyone as you push forward in those ways. Health advocacy and patient advocacy, again, it's about identifying, here are the problems that we're having, and working on with administration for policy to conduct policy changes, because what's happening here in the US is accountability. We will have wonderful publications that will say, here is how you treat sickle cell. Here are the steps that need to be done. The NHLBI put out one. There was an entire blueprint for sickle cell moving forward, but there has to also be accountability. Who is looking at these things and assuring that these things happen, and where is the accountability? And so we have to do that with our providers, with hospital administration. But then also it is important that we do that for ourselves and hold ourselves accountable and do the things that we can do for ourselves, and then fight for the treatment and the just care that we need. Sustaining it is, again, in my opinion, about working with others, because no one individual can take it all on. No one organization can take it all on. By working together, however, collectively, we become a much stronger unit, and it'll keep you from blowing out, KW, as an individual, trying to do it all, burning out. If you are with a strong network of individuals with a similar vision, all commonly working towards the same goal.
Yes, well said, Lakiea. The questions that I've been burning to ask you. There's so much advocacy, and you guys are doing a very good job, not just you, but with a lot of collective organizations in America. But yet, I've seen a lot of negative press or negative information from the sickle cell warriors in America in terms of your healthcare system. It seems like you're doing everything right, but how come you have this, negative impact from this different sickle cell warriors? We have, doctors being called out because of the treatments different patients are experiencing. What is it that's not working for the patients, and how can you make it better?
That is such a fantastic question. And it is one that we have been working on for literally decades. you can find that the same fights are being fought over and over and over again. There's still the horrifying treatment in hospitals. And I believe that's what you're referring to when we are calling out the despicable treatment. I had a doctor that wouldn't even come into the room to see me, and I had a cute chest because, in his words, he had real patients to see. And it is a lot to do with that image that has been created. And we find that it actually starts in medical and nursing schools. This concept of the sickle cell patient as a single monolith entity, that we are all a certain person with a certain way and certain drivers behind it. There are a lot of this, I believe that a lot of this is based in systemic racism, as well as just systemic policies, where in America, there is this instinctual behavior as though, and not just with sickle cell, with anything, your patient is lying to you. And it's up to you to get down to the truth. And I've spoken to so many doctors about this and questioned why this is. Why do you instantly think that the patient is being honest? That the patient, particularly with a chronic illness, doesn't know their own body and recognize what's happening. And it seems to be based entirely in the way that they are trained. You will see doctors finish medical school and they're so eager and they're ready to just do wonders for sickle cell. And then you watch, and you see it in nursing too, as their preceptors begin to teach them, well, that's a sickle cell patient. It's not that, oh, they're just drug seeking. And when those messages get instilled early enough in the career, it then perpetrates and it continues to perpetuate into each and other, and it goes down the line. And we have begun to try to address this by doing what we really haven't in the past, which was go back several steps and start at the point of education in the medical schools, in the nursing schools. Because if you meet Lakiea while she's laying in that hospital bed, she is not necessarily the same person that you will see when you meet Dr. Lakiea Bailey in her regular life. And understanding that and recognizing that we, with chronic pain, we know how to be in pain. I know how to and have run an entire conference from a hospital bed. We know how to write doctoral thesis from the ICU and have done it. We know how to be in pain. But if you compare a person who learned how to deal with pain when they were 3 to a person that is now experiencing acute pain for the first time, we don't look the same. And having to explain that and start earlier, I think, is going to help. Because you're absolutely right. We have done so much. We have unified and are working together. But I found myself even recently feeling like I wondered why I did all of this when I still had to fight for the basic standard of care. We are seeing improvements slow by slow. But at this point, the way things move at such a glacial pace, I do believe it's time for a big unified movement, and to turn this not from a moment of advocacy to a movement that we will do collectively. Because you're absolutely right. There's still so much that needs to improve.
I know. Well, I can't believe we are running out of time. It's 30 minutes just goes like that. We need to have more of these discussions. We have one more question. Let's see, we said 5 minutes. We've got about 3 minutes to go. We have a question from Natalie in the chat box, but just before we go, what next for the Sickle Cell Consortium, Dr. Lakiea Bailey? Where do we go from here in terms of, I like the idea of becoming a movement, not just in America, but as a global movement. And I've seen this comparing with other conditions that are even more rare than sickle cell disease. For example, we've talked a lot about cystic fibrosis, you know, obviously because it affects a different race, but also looking at HIV/AIDS because it doesn't actually affect not just one race, and it's actually become as a movement. Over the years, we've seen that sickle cell as HIV/AIDS patients actually united, and there's that you know, force to reckon with different parts of the world. They're like one voice. How can we become that? And also, where do we go from here in terms of your organization?
You know, I think about Now, my next step specifically, and ours collectively, I think, is to do exactly what you're doing here, bringing together multiple voices from all over. I have so much to learn from you, Agnes. I've been listening in this morning to the sessions when I woke up, and the congratulations also on the success of this and how amazing this is, and the multiple different voices and different countries that are all represented, bringing us all together just like this. I think for the consortium, I know, and I think for all of us globally, the next step is, in my esteem, to connect, to do some of what we discussed at our convention and bringing together the different orgs and the patient advocates on one playing level field so that we can discuss how are we going to connect our orgs and what is our single unified mission so that we can each work in our individual areas with autonomy, but then come together almost as a United Nations, where each organization has its own autonomy and is doing what you're doing in your country, and then coming together collectively to define our global priorities. The consortium was founded on that basis, bringing together the different states to retain their autonomy, but coming together for a United State network. I believe it's time to do that globally. We bring together each country with its autonomy, but coming together to define our priorities, identifying problems, needs, and gaps that affect us globally, and then developing solutions for them.
Definitely. I think that's with the Amplify Sickle Cell Voices, which I will respond. We've extended an invitation, and that's what we're working on with a few members of the team on this panel. Unfortunately, we have one more session to go now. We are going to move to Team Island and just see what they are doing as well in terms of us having this global movement. And I'm excited where we are. We said, this is what we are looking for. For me, I've said sickle cell disease affects people very, very similar. The issues we have, I tell you, for now, this is our second day in terms of the Amplify Sickle Cell Voices. They're very similar, and it's very easy for us to have that global movement, and it can be done. And this is just the beginning. So thank you so much, Dr. Bailey. We'll invite you again. Thank you for making this event a very success for us. So thank you. Isabella, do you have any closing remarks?
I would just like to say thank you also, Lakiea, to bringing up the point that it is a global thing, and that we do all suffer in the same kind of way. We all live the same kind of life, no matter where we are, what our cultural backgrounds are. So it's good to know that we are all going through the same thing, but we're also fighting for the same cause. Just in our logo, it says "Together we rise," and I'm looking at that right now. And just from what you just said, Lakiea, it really, it's clear. It's clear what we need to do. We need to come together, and we need to rise as one big force, and getting everyone to listen to what we have to say, because it's real. It's needed. It's needed. We need it. That's it. Thank you.
Thank you so much. So let's go for our last session for the night before we come back tomorrow. Lakiea, it was lovely to see you, and we look forward to joining you and joining us again. Thank you so much.
Thank you.
Thank you.